Good morning, everyone. We'll wait for a few more folks to come into the meeting. Good morning. This is the meeting number 4 of the POR working group for Wednesday, October 13th, 2021. We'll start out here with, let's see, Olivia, are you here with any? Yep.
Nope, just that I'm continuing to do some research and pulling 2004, 2014, 2015. Other than that, no.
Okay. From our chairs, anything to start out the meeting this morning? We have
Angie is on the road.
Yeah, we have Angie on the road by phone, and Sheriff Heck and Stacy Bettison.
I think that Stacy and Troy were going to summarize the subgroup information, maybe.
Okay, did you want to start that off?
I can.
Okay.
So first of all, thanks to everyone that participated in who are able to participate in the subgroups. We know that not everyone can, excuse me. But we've got 3 subgroups to remind everyone. We have methods, crimes, and requirements. I'm going to give a debrief on crimes and methods, and then Sheriff Heck will do requirements. So in crimes, we had the areas that we're covering in crimes are really what crimes get you on the registry. We're looking at the same set of circumstances provision, and we're looking at triggering offenses that re-trigger the registration requirement. So with that, when we look at what crimes are included, we're also looking at juveniles. There's a lot of cross-pollination in these subgroups. Juveniles comes up in almost every subgroup. Going to the same set of circumstances, that recall when coming out of the CSC working group, we had proposed language that would modify the same set of circumstances. Along with that same language, we had proposed statutory language that removed juveniles, with the caveat that we would need to figure out the EJJ group of juveniles. Since there's some thinking that certain juveniles may need to be in the registry depending on age and the nature of the crime. Going back to same set of circumstances, the group is looking at what maybe there's a classification within that. Maybe it's just false imprisonment that we would take out. We know that Minnesota is the only, we're pretty certain, we're still drilling this down, but we're pretty certain, 99% certain that Minnesota is the only state that has the same set of circumstances. And I'm going to pull on Olivia. Olivia, you told us when that was added in to the statute. Do you recall off the top of your head what year that was?
I can look it up.
Okay.
Really quickly.
Yeah, if you
But I
can.
would say that I think that's the 2014 research that I'm doing, the 2014, 2015.
The same set
Oh,
of
no,
circumstances.
same set of circumstances, no, that's been in there for way longer than that.
Yeah, I feel
Oh,
like
no,
it's
you're
older.
right. I think it was the 90s. I'm sorry.
Okay.
Yeah, I think it was, yeah, sometime in that very early, because, like even Lopez talks about it, I mean, they're old cases. Bolton is the same set of circumstances case, so, and that was I think Bolton's a 1999 case or something, so
Yeah,
it's been in there for a long time.
yeah. We did hear from law enforcement that even if it is a juvenile, there are, there still feels like there's a need for the registry for juveniles. There was an acknowledgement that I think from Sheriff Heck that, we don't have numbers on the registry in terms of using it for the whodunit cases. When we're actually looking for, we know that a crime's been committed, but we don't know who did it. I think Sheriff, and our notes reflect that you did say that there were fewer unknown juvenile cases than adults. And then there's just the feeling that there's just a lot of research. There was, talk in the group that there's a lot of research on juveniles who victimize. Those are juveniles who are victimizing are doing it with people that they have direct contact with. So a registry in terms of the whodunit is there's a feeling that there's less of a need there. And the group talked about how putting kids on the list or on the registry is just not the right, it's not the right time. And that there's plenty of research to show that there's a better way to turn kids around, and that getting them on that registry takes that away from them. Those are the concerns that were discussed in the group. As far as the retriggering, the offenses that retrigger registration, considering list 2 crimes, and so the crimes against the person does retrigger or does require registration. And then there's also any conviction will get you, any conviction resulting in incarceration will retrigger the registration requirement. That's also being talked about in the requirements group. Yeah.
And just to provide correction, it was in 1993 that the same set of circumstances was added. Apologies, everyone.
So just 2 years after the registry was enacted. So that's good to know. Thanks, Olivia.
And Stacy, can I jump in just to clarify that the 243-167 only re-triggers if they've already completed or if they had a prior offense and they never registered for it, but they would have been required to register under the statute. And then the other, I think we had talked about possibly looking if we're going to limit the offenses that extend registration so that you're not registered for just like or extended for like, let's say, disorderly conduct, that list might be a starting point for the extensions. If we're going to limit the types of offenses, that might be a starting point to look at. Maybe that type of offense would extend the requirements, but not like a regular run-of-the-mill disorderly conduct or minor theft or something like that.
Yep, that's perfect. Thanks for that, Angie. So that's where crimes is. I mean, just a lot of discussion still, thinking through, where people are falling. I think one of the things this large group needs to know is that the subgroups are going to receive a survey. Let's see, crimes and methods no, I'm getting confused here. We did a poll in methods, and I'm going to talk about that here in a second, to take the temperature of the subgroup. And excuse me, to take the temperature of the subgroup in terms of, are we comfortable moving forward on a substantive change or are we not? And to understand, because if we're not, then we need to do something else with our time. And we have a report due to the legislature, and we need to tell the legislature, you know, where the discomfort is or where the hesitation is, and what more information is needed in order to move forward. So we did that. Turning to methods, the methods subgroup also met on Monday, and the largest part of that discussion was, can we come up with a ramp off or a petition for removal for registrants who have been law abiding, completed SO treatment, are off parole? Is there a way that we can phase people off to provide a carrot for, you know, doing well? And we took a poll on that. Right, Mark? That was our poll. Just want to be clear. We put 2 questions to our group. The first question was, do you favor no change to the 10-year registration requirement? So it's worded a little funny in the negative, but it worked. So do you favor no change? We had 6 people voting in this subgroup. 4 people said, no, we don't favor no change. In other words, yes, we favor looking at changing it. And then 2 people said, yes, we favor no change. So we wanted to keep status quo. And then as to the lifetime registration, the same question was put. Do you favor no change to the lifetime registration? We had 4 members say yes, no change to the lifetime, and 2 said there should be a change to lifetime. There should be an opportunity to ramp off. I would just say we do have a 50-state survey out there where other states provide a petition for relief or petition for removal, I would say. And so we're looking at that to try to understand what other states are doing. A lot of states have that mechanism for lifetime registrants. You know, that's just a curiosity, but the temperature of the group was no on lifetime. So that's where we're at there. I think from the methods subgroup, what we heard was what I heard, and if I'm misstating anything, especially for Sheriff Heck's part, you know, I welcome a correction. What I heard and see is that for the most part, law enforcement isn't going to be in favor of taking anyone off the registry, because the registry serves as a tool in whatever the case is. And that taking people off at this point is not something that law enforcement, well, or at least as an initial matter, would probably not favor. I think that Sheriff Heck was going to go back to his group, and we need to hear from the police chiefs and that sort of thing in terms of getting a better sense. But Sheriff Heck, is that a fair way to describe it? I don't want to put words in your mouth.
Yes, thank you. I think that was a fair way to describe it. I am waiting to hear back from the MSA as a group as far as what their position is, but that's my initial assessment, of that there's little support in taking people off the registry at this time.
So I will just conclude on that. If there's little support for taking people off, then our work may shift a little bit in terms of, I mean, I think there's still an appetite for this petition for removal, at least in the subgroup, to look at it. And we can continue, and I think we will continue to look at it. But from a law enforcement standpoint, when we go to the legislature, I mean, my read is if the legislature, or if law enforcement isn't going to support it, it's going to be, I don't see the legislature ever, really doing much if law enforcement isn't behind it. So that's an important reality. I think we all just need to name and acknowledge.
Representative.
Can I say, oh, sorry. Can I say something whenever whoever's done?
Sure.
Representative
Raising
O'Neill.
my hand.
Thank you. So I just wanted to emphasize the fact that if law enforcement's not on board, or quite frankly, if any very large contingency of folks that are represented here, like probations, law enforcement, victims' rights groups, if they're opposed to a change, it will not move forward. We have to have consensus. That's how we did it with the sexual assault statute reform changes. And there isn't a chance of it moving forward in the legislature unless all the parties at the table agree. Because this is a huge change. This is a very controversial thing. There is not a lot of appetite at the legislature to move something like this forward with a change. So I'm going to be emphasizing that this whole time, unless there is agreement for a change with all the stakeholders, it will not move forward. And the last thing I want to say quickly as you continue report is I think that we need to have a serious conversation about what we already have in place as for juveniles, which is the 1-year stay of adjudication, to make sure that those that quote unquote don't belong on the registry don't get on the registry, because that is already in law and in practice. And we haven't had much of a conversation about that. I'm hoping Renee might speak to that a little bit since she's from probations. But to take, so, we only have 38 out of 18,000 on the registry right now that are juveniles, and there's a reason for that. So I think we need to have that conversation in a little more depth. Thanks.
Angie?
Oh, so I was just going to say, I talked about this a little bit at the co-chairs meeting yesterday, but the other thing that may, I think, impact the whole off-ramp issue is if the group does decide to eliminate or limit juveniles, and if the group decides to eliminate or limit same set of circumstances, and if the group decides to limit extensions of the time frames based on offenses or altogether, those kinds of things may alleviate the need for an off-ramp, or at least reduce the need for an off-ramp, because you're going to be getting less people on there who maybe shouldn't be on there or in that gray area. So I just wanted to point that out, that may affect the usefulness of an off-ramp if the other things go through.
And I did just want to add, I know that Representative O'Neill and Senator Ingebrigtsen had asked me to follow up with Drew about his thoughts on the off-ramp. He feels as though he needs more detail as to what that would be, what that would look like, what all of those requirements would involve in order to have a stance on it. I think he just needs to better understand what the off-ramp looks like.
Stacy.
Yep, and I appreciate Representative O'Neill's comments about the consensus piece. That's well understood, and I think that's good that we acknowledge that reality. The one thing I would say about the juvenile, the numbers, I think Representative O'Neill, you said I think 38 are currently on the registry as juveniles, but what I think that, and I don't know that we have this data, and if you provided it, Olivia, my bad for not fully understanding what we have and what we don't have, but that doesn't account for all of the adults, the now adults who came on as juveniles. So there's a difference there. And I don't know if we can get those numbers or if we have those numbers, Olivia, maybe you've provided them. But I think that's just important to acknowledge that there were people that came on juveniles and now they're adults. That's the way I understand the data.
So it depends on a couple of things. One, it depends on whether or not those juveniles, well, first, it depends on whether they received a stay, in which case they wouldn't be on regardless of the status. There are very limited circumstances in which a juvenile would continue past the age of 25 unless, well, actually, there are no circumstances unless they had reoffended. So, yes, there are some juveniles who are currently adults, but they can't be 45 and have had the one offense.
Right.
In terms of the data, we are trying to figure out if we can cross compare some of the data that we have in the criminal history system with some of the other data. I've asked folks to take a look and see what we can pull, but no, we don't typically hold somebody's criminal history and flag it along the way. So we would, in the POR system in and of itself, we would only have their current status and their location, those kinds of things, all the items that are on the registration form. We wouldn't necessarily know their whole criminal history.
Yep, understood.
I'm raising my hand. I
Hi,
think
Angie.
that they could be I think they could still be on the registry at an older age if they ended up falling under those extensions though. So like if they
Yes,
were
that's
there,
what I
let's
mean.
say,
Sorry,
8
guys.
Yeah. Okay.
So if they
potentially
continue to
an adult could
reoffend,
have
yes.
Right, and if they continue to
Well,
reoffend in any, and it could be a non-sex offense. It could be a non-predatory offense, right? It could be in any offense that resulted in incarceration would have done a retrigger. I think we're all clear on that. So my summary of the subgroups is done.
Brian,
I was just gonna say the same thing Stacy and Angie just clarified, that it's not necessarily a predatory reoffense or sexual reoffense. It's just anything that re-triggered and extended the registration. Correct.
okay. Sheriff Peck, did you want to go into your?
Certainly. So I'll be summarizing the requirements subgroup. The discussion on this subgroup meeting started off by looking at the forms that predatory offenders are required to fill out, and or the officiant that is registering them is required to fill out. It's a 6-page form, and most of that information on that 6-page form is completed by the official that is registering them, with the minority of it being completed by the predatory offender themselves. There was a discussion about what that looks like, and the fact that offenders have access to, for example, a probation officer that could answer questions, or law enforcement official that could answer questions if they have that. There was some concern about the length of the form and perhaps how understandable and user-friendly it was. Next, the group talked about the history of the increased penalty for failure to register, failure to comply. It was mentioned that this was brought about because the bench, Rich Stanek at the time of the change testified that in the city of Minneapolis, they only had a 35% compliance rate when the penalty was, I believe, a gross misdemeanor. And so law enforcement was seeking an increase to that penalty to incentivize compliance. The question was asked, well, what is compliance currently? And we were able to get the statistics that statewide compliance after the change is currently sitting at 90%. There was some discussion regarding the crimes that trigger extension on the registry. The question is, should those be any crimes as the current law states, or should it be a a sex offense, or should it be some other type category of crimes? It was brought up that some of these crimes, some of these folks that are on the registry are also committing other crimes such as robbery, burglary, those type of things, and that's being demonstrated by DNA evidence. It's being compared from some of these crimes to untested rape kits. So there's that concern. There was also a discussion about the equity issue of if a change is made, is it equitable for those who are currently on the registry who had their registration extended based upon the current law versus what a new law might look like. And then we went into further discussion about, again, what should be the triggering offense for this extension? Should it be any conviction? Should it be crimes against a person? There was a listing of crimes that were defined as crimes against a person, or should it be simply sex offenses? The next topic of discussion focused on the registry and the idea that, as has been expressed, this registry was conceived as a pool of people who had committed sex offenses and was to be accessed by law enforcement initially as a potential group of suspects when we had a case that needed to be solved and we didn't have a direction to go as far as who that suspect was. And that discussion talked about how a lot of the collateral consequences that individuals on the registry are experiencing today are a result of legislative changes along the way that have changed and increased the people that have access to this registry, which again was initially conceived as a repository for law enforcement. The group had discussion about what could be done about these collateral consequences and whether or not the legislator would have authority to influence the local ordinances that are the source of some of these collateral consequences. And finally, there was discussion about, as was brought up just a little bit ago, the fact that the legislature, when weighing these changes, is going to want to know how these changes would affect public safety, and that any changes that are proposed are going to need to have some type of demonstrable effect to increase or retain public safety. And with that, I'll yield my time.
Any questions? Anything additional here? Did we want to, Stacy, did we want to move into Brian's presentation at this time?
Yeah, I think so. We can preface it by to the group by letting folks know that we're going to hear from Brian and then Eric Janis from Mitchell Hamlin about what we know about the recidivism research on people who are accused and convicted of sex crimes.
Hey, you want me to get started? Sounds good. All right, well, good morning, everyone. I'm going to share my screen. I have a PowerPoint. Hopefully this will work out all right. All right, can everybody see that okay?
Yes.
All right. So should just also preface my presentation saying that I have two canine co-presenters with me today, and I'm hoping they are well-behaved. Coco and Fletcher may, if the mailman comes and drops the mail off, they may get a little fired up, but we'll try to work around that. So again, don't really think I need an intro. I've been with the group since the beginning. I worked in risk assessment community notification unit for the Department of Corrections. Been there for 23 years with the department. And I'm going to talk today about we just talked about the off-ramp idea. I think this desistance from sexual offending research and sort of a mechanism for how we could look at that maybe can change some minds about the lifetime registration poll and those kinds of pieces about maybe not having that be something that's considered at this point. So I don't know if we just want to keep questions until the end. I'll just kind of roll through, and that's the best way to do it. So how the idea of desistance is structured around the idea of actuarial risk assessment. So in the field for many years now, we've the idea of using actuarial risk assessments for the prediction of sexual recidivism is sort of the go-to method. Years ago, we used what we call clinical judgment. It'd be like me sitting down with a file saying, based on my expertise and knowledge in the area, I think this guy's high risk, this guy's low risk, those kinds of things. Problem is there's no consistency. There's a lot of individual bias that comes in. It's really no better than a coin flip. Even if I want to say, I really know what I'm talking about, I've been doing this a long time, it's kind of a hit to the ego, but it's really, for the most part, ineffective. So what the field has moved into is this idea of actuarial risk assessment. You see the definition there refers to a structured evaluation of variables that are combined in a systematic fashion to produce a statistical estimate of risk, a numerical probability statement. This person scores a 5 on the static 99, and they present a 15% likelihood of sexual recidivism within 5 years, just as an example. To break this down for people a little bit more who don't use these instruments a lot, I talk about the car insurance example. So really, when we're evaluating those that are committing future sex offenses, it's similar to what's been used in the insurance industry for many years. So you have an individual, a 17-year-old male, he has poor grades in school, and he already got into a car accident with a year of getting his license, right? His car insurance premiums, he falls into a group of individuals that are much more likely to get tickets and future car accidents. He has risk factors. He's gonna have to pay a lot more for his car insurance, as opposed to a middle-aged married woman with no history of ticket or moving violation at all. She's gonna fall into a lower risk group as a group because she doesn't have as many risk factors for future accident, future ticket, that kind of thing. We're doing the same thing with men. I'm going to mention men here. There's no valid actuarial risk assessment instruments for predicting women that to commit future sex offenses. The numbers just aren't there. Nothing's been validated. So when I talk about men, I'm talking about adult men here. One of the main tools I'm going to talk about today is called the Static 99R. People aren't familiar with that. It's a 10-item tool, looks at things like prior history of sex offense. Did they offend against an unrelated victim, a stranger victim, a male victim? How old are they? Some of those factors combine to get an overall score, which I'll talk about a little bit more later. But those are just kind of an example of what actuarial instruments are. That being said, this is not the be-all, end-all. I know some people have talked about limitations with actuarials. Some of the strengths, though, as I said before, it's not just me or anyone sitting down with a file basing the information on their knowledge. Their own personal bias can come in. There's no consistency from rater to rater. Here we have empirically validated risk factors. They provide explicit probability estimates. They're really robust across the Static 99, and many of these tools have been normed on a variety of different samples in Europe and Australia and the US and Canada, a lot of different populations dealing with many different racial and ethnic groups as well. So they really hold up over a variety of different settings and samples. And they're fairly easily scored with proper training. It mostly involves a file review. There's not an interview required for most of the actuarials. Now, that being said, one of the couple of the weaknesses is, they're a good starting point, is what we always say, that they only have moderate predictive accuracy. So there's going to be times when guys score low, they fall into a lower risk group, they go on to reoffend. There's many guys that score very high that do not go on to reoffend. So, we do the best we can with the information we have. We always want to do better. There's consistent research. A lot of it's coming from Canada and other areas about improving the accuracy of our predictive mechanisms. It also neglects some important factors. Deviant arousal is one of the biggest predictors of sexual recidivism. Somebody who's attracted to prepubescent children diagnosed with pedophilic disorder, as an example. That person's going to, in general, be more risky than somebody who does not have that deviant arousal. That's not taken into consideration on an actuarial instrument. It's something outside of that pool. if somebody sits down in the room and they score really low, and we're going to assign them a risk level 1, and the committee is meeting with them at end of confinement review committee, and that person says, you know, I'm really nervous. I'm strongly attracted to kids, and I think I might do this again when I get out. At that point, the actuarial instrument takes a back seat, right? I mean, this is somebody has verbalized intent to reoffend at that particular time. It's a very rare occurrence. It doesn't happen frequently at all. So infrequent that we can't have it as an item on any one of these actuarial instruments. So just wanted to talk about how our overall risk assessment needs to be comprehensive and look at individual factors outside of the actuaries. But it's definitely a good starting point. So now moving into the idea of desistance from crime in general. Most of these definitions are taken from the 2017 Hansen Thornton paper that I'll be referencing throughout the presentation. And if we haven't provided a copy of that yet, I'll do so at the end of the presentation. It's called Reductions in Risk Based on Time Offense Free in the Community. Once a sexual offender, not always a sexual offender. So the general definition they're saying is a marked reduction in the propensity to commit crime, often operationalized in research studies by an absence of self-reported or officially recorded crime for a specific number of years. Another way to look at it is a reduction of risk that is equal to or less than the rate of spontaneous new offenses among individuals who have never been apprehended for a criminal offense. Yeah. From a sex offense standpoint, what the authors of this study are saying is a plausible threshold for desistance is when an individual's risk for a new, so somebody who's committed a sex offense, their risk for a new sexual offense is no different than the risk of a spontaneous sex offense among individuals with no prior history of sex offense, but who have a history of non-sexual crime. They're saying that makes sense to use that as sort of this desistance threshold, right? How they back that up, there's another study, Kahn and Hansen from 2017, reviewed 11 studies from diverse jurisdictions, over 500,000 people in the mix there, found a rate of spontaneous sex offenses among individuals with a history of non-sex offenses to be in the 1% to 2% range after 5 years. So this is people with criminal histories, no known sex offenses, that then commit sex offenses. It's about a 1% to 2% chance after 5 years. That's what they found. So they're using that 1% to 2% as sort of this desistance from sex offending threshold. This is exactly what I just said. So concluded a sexual recidivism rate of less than 2% after 5 years is a defensible threshold below which individuals with a history of sex offense should be released from conditions associated with a sex offender label, or at least modifications should be looked at. The authors are clear to point out it's not zero. We would love for things to the risk to be zero. That's just never going to be the case for sex offenses for any crime. So using a defensible threshold of less than 2% is kind of what they're going with. From a risk management perspective, resources used on these very low risk individuals would be better spent on higher risk individuals, prevention, and victim services. This plays into what we call the risk needs responsivity model that is very common in the industry, where we want to be able to, off-ramp low-risk guys, whether it's registration or other things, treatment, supervision. We're using this risk needs responsivity model in our statewide supervision of individuals who've committed sex offenses and treatment length and intensity by scoring what we call the static, and then another instrument called the stable, using combined scores to identify lower risk guys that don't need as much treatment. Not everybody needs 5 years of outpatient treatment. Not everybody needs intensive supervised release for 3 to 5 years. So we're giving our best stuff, our most resources to the highest risk populations. It's really the best way to go about it. So breaking down
Brian,
this.
Could you talk about? Oh, sorry.
Yeah, go ahead, Angie.
Forget it. Oh,
Okay.
I just gonna say you mentioned this. I know you weren't supposed to interrupt you. You mentioned the stable. Could you just talk about what that is?
Sure. So the Stable 2007 it's another actuarial instrument, but it's really, so the idea of actuarials now has evolved into what we call dynamic risk assessment. The static items are just as they sound. static. A guy really can't do anything to change his score outside of committing a new offense. It's really out of his, control. He gets a 6 on the static for the most part. What I'll talk about later is now there's been some movement in lowering that score. There's a table that I'll talk about toward the end, so that's not exactly 100% true. But what the stable does is looks at dynamic risk, things like impulsivity, hostility towards women. There's a sexual preoccupation or compulsivity item, things that guys can, through treatment, through supervision, through kind of figuring it out, saying, hey, I really need to reduce things in this area. I need to reduce my masturbatory habits or my thoughts about sex in general. I need to develop different belief systems that aren't misogynistic and negative and hostile towards women. I need to reduce my impulsivity, just as some examples, things that are more in control of the individual through treatment. They can lower their score. Now, at that same time, they can raise the score if they do poorly or on some of those different items. We want to know both ways if risk is changing there. Yeah, so that's kind of a brief overview of what the stable is. So just getting into the study a little bit more, the 2017 study I mentioned, they modeled long-term risk of sexual recidivism. It was over a 25-year follow-up. There was about, I think, 400 of the 7,000 from year 20 to 25 they still followed that long. Most of them weren't followed that long, but it was anywhere from 6 months to up to 25 years. The results found the likelihood of new sex offenses declined the longer individuals with a history of sex offense remained sex offenses. The bottom one there, after really what they found is after 10 to 15 years, most individuals with a history of sex offenses were no more likely to commit a new sex offense than individuals with a criminal history that did not include sex offenses. So had kind of reached that desistance point. And I'll show this chart that shows that, visualizes that a little bit better in a minute. One of the questions that often comes up and that we'll talk about and that was factored into this study is non-sexual offending during the follow-up period did increase the risk of subsequent sexual recidivism independent of the time-free effect. So when I show you the graph in terms of how people's risk is reduced, there's a mechanism that's built in for taking into consideration guys that just continue to commit, drug offenses, DUIs, other non-sexual crimes. So we'll get to that in a minute too. So one of their thoughts is the policies designed to manage the risk of sexual recidivism need to include mechanisms to adjust initial risk classifications and determine time periods where individuals with a history of sex crime should be released from conditions and restrictions associated with the sex offender label, or at least they should be modified. One of the take homes. So some visual stuff, the graph, it's tough to see, but what this shows the initial normative sample of the static 99R, guys that were in that sample. The green line, this is what's called a survival curve. They're used initially in medical research to track cancer patients and how long they survived over time post-diagnosis. This is modified to look at sex offense recidivism. So what you have here on the x-axis is the years of follow-up, 0 to 25. Y-axis here, the vertical axis is time of percent of time without reoffending. So the top here, you have 100% of the guys the survival here is did not reoffend. So at day 1, year 0, 100% survivor, nobody reoffended. Over time, you see 3 different lines here. The green line is the lower risk guys that has scored on the static 99, and sort of there, even after 20 years, you have about a 5% reoffense rate with the low risk guys. Moderate guys are the yellow line here in the middle, and you're looking at about 15% after 25 years for them. And then the high risk guys reoffend quicker and at a much faster rate than the other categories. So the tool is essentially doing what we need to do and what it needs to do in terms of predicting likelihood of recidivism. However, after 5 years, men who'd made it 5 years without known sexual reoffense, the slopes narrow and lessen to quite a degree. So much so that this new line, this yellow dotted line was the moderate risk guys on that initial, graph that I showed you. So really the high risk guys after 5 years are dropping into that moderate risk range. Just a visual way to show that. After 10 years, you really see all three categories sort of following into that low risk, that initial low risk category of guys from the initial graph. One of the other things that happened around about 5 years ago or so is the Static 99 and some other, they wanted to improve risk communication. One of the problems is you have the static and they have their categories of low, moderate, or high. And you have the MnSOST, Minnesota Sex Offender Screening Tool, and their different categories. And a lot of different tools, just there was different interpretations of what that meant. They were poorly defined, difficult to compare across measures. Okay. But there was a broader movement toward improved risk communication at that time. What happened was they wanted to develop categories that could describe psychologically meaningful characteristics of the individual, not necessarily the scale, be linked to realistic options for action, be evidence-based, applicable to all risk scales, use a simple professional language, and be easy to implement across diverse jurisdiction scales and individuals. Okay, so what they did is the standards that the Static 99 group came up with, and I'll talk about a little more in a minute, are modified slightly from the standardized risk levels developed for the general correctional population by the U.S. Council for State Governments Justice Center. They address the crime-relevant characteristics of individuals in the criminal justice system, the intensity of correctional supervision and rehabilitative programming needed to reduce their risk, their personal strengths, and their expected prognosis. Again, maybe tough to read for some folks, but this is the graph that really identifies those groups that in those standardized risk levels they came up with for the most part. These are the general groups that council came up with, 1 through 5. What the Static 99 group did in terms of sexual reoffense and groups there, they found this bottom category, if people can see my cursor here, category 5, where it says virtually certain to reoffend. 85% will sexually reoffend after 5 years. There was nobody in the initial samples that reached the 85% virtual certain to reoffend threshold. Even the guys that scored in the well above average category in the static, which is scoring a score of 6 or higher, they were within between 20 to 50% recidivity. So still very high, but it wasn't what they considered virtually certain to reoffend. So they adapted this, and what they came up with is category 4A for what's considered above average risk, and category 4B instead of 5 is well above average risk for that 20 to 50% reoffense range. But you get an idea here of the likelihood of reoffense. It talks about risk relevant problems. This bottom level group here, they're scoring a -3 or -2 on the static. It's about the bottom 5% of guys that are scored on the tool. Really, if you left them alone with, they committed a sex offense, their likelihood of committing a future sex offense is no different than somebody with a non-sexual criminal history, their likelihood of committing their first sex offense, right? So really minimal, if no community services needed, they're going to kind of stay low risk. This category 2, there's a few problems, milder transitory. They have some resources, some strengths, some protective factors, very minimal management recommendations here. Most of these guys, the prognosis is very good. They move from a 2 to a 1. A big chunk of people, about 50% of the group, falls into this average risk category. Guys that are going to benefit from some treatment, some supervision level, but the prognosis is still very good about them kind of moving downward. Okay. Top level guys here, a lot more resources. This is where we really want to focus our, most of the resources up in, from average on up here. All right. This graph is really what they came up with in terms of measuring time-free effects in the community. Okay. So each of these categories is what I just mentioned. The -3 to -2, the blue area is those level 1, very well below average risk. The -1 to 1 is the below average risk guys. The yellow here is the average risk, that category 3. And you have 4A and 4B for the above average, well above average risk. So what this is showing is, and their research is showing, we can use this in looking at static scores over time. If you have a guy who scores a 6, and he at year 0, he's in the well above average risk category. Okay, he's going to need a lot of resources, a lot of support, those kinds of things. If he makes it 8 years offense-free in the community without any non-sexual offending, sexual offending, this risk really drops into that average risk category at year 8 for a guy like that. And you get some other ideas here. You have the average risk guy scores a 1 really after 3 years. So kind of between the year 3 and 6, those average risk guys can reduce their overall risk. Well, we have to factor in what they've done for, let's say this guy who scores a 6 makes it to year 8 and has some non-sexual criminal history in there somewhere. We subtract 3.3 years to kind of take 3.3 years off. We bring him down to like a year 5 in that scenario. So now he's still dropped a category, but he's at that 4A level of risk instead of 3. So like I mentioned before, the results of the non-sexual criminal history do increase the likelihood of sexual recidivism independent of the time-free effect. So that's how they factor all that into the graph. We're using this graph now when we do our reassessments for community notification purposes. Guys that are assigned a level 2 or 3 meet certain criteria, usually after several years in the community. And we score the static, look at how much time offense-free in the community they've had. For instance, I had a guy who I think he had a 4 on the static at time of release. He's now, he actually was reduced to a 2 years ago, and now was just reduced to a 1. It's been in the community for, I think it's 10 years now. So he's down into this average risk range at that particular time. So we combine the static score. We also use the stable score. What has he done from a dynamic supervision standpoint in terms of treatment and reducing his risk? Factor those two in. There's another whole chart that I won't get into today that combines the static and stable scores and really gives you sort of a supervision priority level that we look at for those guys. This one, yeah.
Sherry had a question about how often are these tools administered?
I think, at least in Minnesota, I'm not sure. For our purposes, we're only using them for the reassessments cases. So, and in my unit, that's specifically the reassessment is around level 2s and, well, typically level 2s and 3s. Not all the time. We look at reassessments for sometimes a supervision agent will find that a guy thinks his risk has increased. So we do look at both ways. Sometimes guys have increased their risk and we increase their risk level. Oftentimes guys decrease their risk, we decrease the risk level. But outside of my particular unit, I guess I'm not sure statewide at this point. I do training on the static and stable statewide to supervision agents and therapists from around community treatment programs and encourage the use of these things. There's some grant funding and grant dollars tied into the use of dynamic risk assessment in general, using the static and stable and readjusting things to fit in with that risk needs responsivity model. Agents are overworked, therapists there's too many people, there's waiting lists. So if we can, like I said, open up spots in treatment for guys that are higher risk and that need longer, more intense treatment and longer, more intense supervision, and really off ramp or give less priority to those guys that are going to do well really outside of anything we do anyways. That's just the best use of all our limited resources. So I guess I don't have a great handle to answer the question in sort of a roundabout way on how other places are using this particular data.
is the DRA.
I can't,
Yeah, so the dynamic risk assessment group is using more often the combined static and stable chart. I didn't have that in my presentation. I can bring that to another meeting later and discuss that. But it shows combined static stable scores and then being able to, modify supervision levels based on that. So a lot of CCA counties are jumping in, I've trained Hennepin, Ramsey County folks, a lot of most DOC, around the state now on those instruments. This just really quickly, and then we'll open it up for some questions. This is the kind of the time-free effects calculator. Most people, tough to see as well. It's an Excel spreadsheet. I'm not going to run through it right now. There's still, we just had a training on this with the Canadian folks that developed this. But here you're punching in a lot of different variables. Recidivism risk, at what year, was there any other non-sexual convictions that need to be considered? And it really comes up with a number of values and sort of a probability estimate of risk for an individual person. So there's a lot of Excel spreadsheet nuances that need to happen with enabling macros and a lot of these things that I didn't feel we needed to do today, but another mechanism for sort of recalculating risk. And then finally, just some implications for public policy that they talked about in that article. 3 things they said: the most efficient public protection policies will vary their responses according to the risk level presented. As I just talked about, risk needs responsivity. One size fits all isn't really the best use of resources for everyone with limited time and budgets and all those kinds of things. So give our best stuff to our highest risk folks. Efficient public policy responses need to include a process for reassessment. That's just what I described. I think this mechanism might be a nice starting point for, talking about really what that research found is after 15 years, even the highest risk guys are very unlikely to, have really met that desistance threshold. There was only one guy in the study out of like 394 they tracked from year 20 to 25, one reoffense after 20 years. So again, maybe some more discussion about the need for lifetime registration. And then should be an upper limit to the absolute duration of the public protection measures, and kind of what I just talked about there too. So that's some suggestions, implications. There's a YouTube video, Andrew Brankley, I think I mentioned this before, he breaks down essentially what I just did as well. So with that, I think I stopped sharing. Time for questions. I know we have Eric Janis is coming in to talk at some point too, so I don't know what we want to do.
Yeah. Let's make sure the earlier comments or questions get answered. And you can all ask these questions too, if you would like, but
somebody wants to throw whatever one my way, I guess.
Yeah, the comment from Sherry Schultz was, it seems like a viable recommendation for targeting appropriate therapy and supporting the data required for off-ramping. Should we examine this more thoroughly? And then from Renee Merkins, for probation, the static is administered one time and the stable is administered annually.
Yep, and we, just to follow up on Renee's comment, yep, the static is, unless outside of new information, maybe you have victim information, a male victim you didn't know about before, there's some changes that can be made there, but it essentially requires a new sexual reoffense to rescore a static. But the stable is that those dynamic factors. So we want to see if a guy's in treatment and his static or stable is increasing, we need to maybe put some more resources his way to help reduce that. Guys that are reducing their risk and those dynamic factors are lower, we can, give them less, get them out of treatment earlier, less intensive treatment, all those things. So we want to know both ways, and that it gives us a good, method for examining that. So, yeah.
And then the comment from Janine Yes, therapy does use tools to monitor dynamic factors, those that can change. Administrators need to be trained, but they are not costly to implement.
And I can just follow up, but yeah, and maybe I wasn't clear earlier. Yeah, most of the statewide programming, at least outpatient, the folks that I train at Core, Professional Services, Alpha, Project Pathfinder, have been trained on dynamic risk and are using the tools on some level. Again, tough to monitor each individual program, and they have different things that they're doing, but as a general rule, yeah, people are implementing it's best practices. It's empirically based, and so yeah, that's what they're doing.
Okay, Representative O'Neill.
Thanks. Brian, can you help me understand how the civil commit for MSOP? So I think we've released maybe 2 in all the years it's been there. Over 600 men are there. Can you tell me how that fits into these graphs and charts? And, because we've got an awful lot of offenders that we as society believe cannot be reintroduced into society. Can you just explain to me how that fits into your presentation and the risk assessments? And are those the ones that are in the red, or, can you just help me understand that?
Well, and maybe I don't know, Janine, if you want to jump in here as MSOP, Janine, as clinical director at the Civil Commitment Program, so I can talk more specifically about what they are doing and those things, I think, at this point.
Sure.
Yeah.
Sure. Thanks. It's a good question. Actually, there's 35 individuals that are currently living in the community that went through MSOP. The courts are really accelerated their placements both in transfer and in provisional discharge. And we do have a handful of individuals that have been fully discharged from civil commitment. So if anyone's interested in that, I can certainly give specifics on it. To the question about, so the people that come to civil commitment have already served time in corrections. So they're very institutionalized. They've probably done 10, 15, 20 years in prison, and then are civilly committed to the Department of Human Services. So their static number, to Brian's presentation, that static likely hasn't changed because they have been locked up for so long in an institution. When clients come to MSOP through the court process to be initially committed, stable and static assessment tools and others are used and handed to the courts in helping make those decisions. And similarly, those same tools are used and handed to the courts to make decisions with regard to liberty. So throughout this whole process of this comprehensive sex offender management and treatment process in Minnesota, these are very common tools for all of us, regardless of level of risk or level of intervention. To Brian's comment on risk needs responsivity. So we do use dynamic risk factor management and assessment throughout a client's entire time in treatment. If you think of dynamic risk factors, they really are treatment targets. What does this client need to target in treatment to decrease their risk for reoffending? And those look really different for different individuals. That's the information we get from a stable or a dynamic tool. I'm not sure if that helps answer your question. I'm happy to talk more if you have more questions.
Was there any follow-up to that, Representative O'Neill?
Yes, thank you. So as I always do, I came and I toured MSOP, Civil Commit. And when I was there, I was informed that treatment is optional and it wasn't utilized much. So maybe things have changed since I've been there, and I haven't toured any place since COVID because everything shut down. But I did not know that 35 have now been released. That's news to me. Last I heard it was only 2, so that's enlightening. Can you talk just a little bit, because these are deemed as the most at risk to reoffend in the state of Minnesota. And since now there's 35 that have been released as opposed to 2, which is the last number I had heard, are you still, I know you're civilly committed, so treatment has to be an option, but are men actually utilizing options? And since you've had 35 released, can you just talk a little bit about what you've done to the treatment and so on? How do we know that they are at a risk level that's tolerant to be released into the public? Can you just talk about that just a little bit, and if there's been some change that, because when I was there, nobody was essentially going to treatment, and it was
Sure.
disappointing
I
what I
appreciate
saw.
Yep, sure. I appreciate that. Actually, we have recently, as of this year, Representative Tina Liebling on the Health and Human Services Committee. Our executive director, Nancy Johnston, did a presentation there, and actually Eric Janis was there as well. So those are on file. Those PowerPoints are on file, and I can certainly send those to you because those would have current data and stats and updates. I've been at MSOP since 2008, so I cannot speak about MSOP prior to that. Since 2010 that we've been keeping an internal research database of the program, there's about an 85% participation rate with individuals who are committed to MSOP. That said, clients wane in their interest and motivation. You can imagine some clients are more willing to make the changes they need to, and others join treatment and then drop out. But we do an annual report to the legislature every year that has these stats in it as well, which I can make available to anyone. That does show on average an 85% participation rate, which is a little higher than most civil commitment programs in the country. So what treatment looks like for somebody with COVID, it's been a little bit dicey as far as social distancing, but we have continued to do treatment with clients during this whole time. The clients, just to remind people that clients who have an increase in liberty, whether it be transfer, provisional discharge, or full discharge, those determinations come from the courts. And so MSOP doesn't, we can give information about where a client is in treatment, but outside risk assessors or evaluators write reports on these clients, and they provide the information to the courts. So the risk tolerance threshold is dependent on the 3-judge panel. So the clients that have made it that far, who are then placed on provisional discharge, MSOP staff continue to do that supervision because they remain under the commissioner of the Department of Human Services. So they don't transfer to like Department of Corrections or parole agents. They stay with MSOP, which is really helpful because we've known them for a very long time. So there isn't a handoff to a different system. And what our monitoring looks like out in the community. So far, we have not had that we're aware of any reoffending that has happened for clients that go out there. And there's a tier system of step down for clients who are on provisional discharge. After a period of time, they all go out to a supervised living setting, monitored, and eventually many progress down to, actually we have clients that have purchased their own houses and are in independent living that are still under our supervision to varying degrees of intensity, working, living their lives. Some clients have aged a lot, because as you can imagine, they've been institutionalized in corrections and with us. And so we do have some clients in medical group homes that are just not ever going to be able to live probably independently. But further details about that, I can certainly make available. I could for this group or for anybody else if there's interest. I'm not sure if I covered everything, Representative. Did you have other questions?
Representative Moeller.
Thanks, Brian. Your presentation was really helpful. And one thing I've been wondering about when we talk about reoffense, especially for sex crimes, is how are we measuring that? Is that based on police reports, arrests, convictions? We know sex offenses are grossly underreported. And so I'm just curious if that's taken into consideration at all.
I know for the study I mentioned, the 2017 study that was the primary focus of the presentation, it was there was like 20 samples, and I think 9 of them were based on new charges and 11 based on new convictions for sex offenses. They didn't see a discernible difference when looking at the data between the charged and convicted folks in that particular study. I know for different studies, it's different. Some is based on arrest. This study also does talk about, if I could find it here, I was highlighting a few things as I was going along. So they say it's based on criminal history information. We know criminal history records are informative, but incomplete indicators of criminal behavior. So consequently, this is on page 3 of the study, we cannot conclude from an observed recidivism rate of 10% that the remaining 90% have committed no crime. Some simply haven't been caught. It's also important to distinguish between reductions in an individual's propensity to commit a crime, for example, deviant sexual interest, low self-control, sexual preoccupation, intention to reoffend, and actually committing sexual crime, detected or not. So it says, given the new wave of sexual offender policies are intended to prevent reoffending in individuals with enduring propensities for sexual crime. Propensities are the central constructs guiding current public protection policy for this group. So they're well aware that it's underreported in general, you know, and that's factored in, and they take all that into consideration in the research.
So Brian, I have a question about leveling at the DOC and the static 99 and how that's related. So in looking at the graph that you showed, would it be like 3, 4, and 5 that are level to level 3? How do you relate scores on static 99 to leveling of the offenders upon release or prior to release?
So, yeah, good question. We actually use the static and stable for the reassessment process, and for making determinations related to civil commitment, you know, screening process. But our end of confinement review committee, we use the Minnesota screening tool, MinSOST 4. It's its current version. In terms of cut scores, there's a low, moderate, and high cut score range based on the MinSOST 4 developed by Dr. Grant Dewey from DOC. So separate actuarial tool used in the assignment of risk level at this time.
Sheriff Heck.
Thank you. Just to start off, I want to say that I have nothing but the greatest respect for the tools and the practitioners that use these tools and their application. And I'm not arguing with any of the data you're presenting. I just want to kind of frame the conversation around the relationship between these tools and the predatory offender registration, and kind of bring us back to the fact that this registry was initially conceived as a pool of people who have differentiated themselves from the general population by having committed a predatory offense, so that law enforcement would have a pool of people to delve into as a starting point for where we might go to try to solve some of these crimes. As I listen to the presentation, it seems to me that these tools are most applicable to supervision and rehabilitation processes, that we can use these to help point people who have committed these offenses in the right direction and keep them on the right path that we all want them to go on. The POR is not a supervision or rehabilitation tool. It's, again, a repository of names of people who have committed these offenses that law enforcement can turn to initially to try to find similarities between cases they're investigating and people who have done these things in the past. And as Brian mentioned, these tools cannot be perfect because we're talking about people. They can only be predictive. And even if you're talking a 1% to 2% recidivism rate, that still means that some of these people are going to recidivate, are going to commit new offenses, and they would be in that pool of people that we could look at as potential suspects. So I guess my ask here is that when we're talking about using these tools to decide who might and might not be included in this pool of potential suspects that law enforcement could look into for similarities, I'm going to suggest that we want to err on the side of inclusion, because if you don't, you're reducing the value of this tool for law enforcement. If you're excluding people that have only a 5% recidivism rate, I mean, that's people that are going to commit crimes that we may have been able to look at as potential suspects and further an investigation, or even 1% or 2%. And when we have a crime that involves an unknown suspect, I would much rather be able to go to the victim or that victim's family member and say, look, we have this exhaustive list of people who have committed these offenses in the past. We are going to compare the details of your case to what we know about these people to see if we can find potential matches. It may very well be that your suspect is not in here, but this is going to be our starting point, and we're going to do our best to find that person.
Okay, we're going to be trying to wrap up this section because we have Professor Eric Janis with a presentation, but we want to finish up here with Patty and Janine have questions.
I just want, it's a really short comment. At some point, I would really like to discuss the language. Predatory offender is very inflammatory, and most sexual offenses are with someone that's known to, especially with kids, somebody that's known to them and situational, and we're throwing everybody in one huge pot that isn't fit for everybody. I just want to discuss that at some point, how we talk about this problem. Thank you.
And Janine.
Thanks, Mark. I really appreciate Sheriff Heck's comments there. I think having a list of names for law enforcement to look at was the spirit of this law. If that was the case, I would actually agree with you of putting as many names as you want in there if it was only for that. When we think of the consequences of being on the registry for some of the clients in their lives, it bumps up against research of what we know individuals need to stay on that desistance path. So if someone could still find housing and could still find a job and could still live a life of purposeful belongingness or meaning or connectedness that we know by research helps people stay out of trouble, I would be all on board, sir, and give you as many names as you wanted if that was all that was what it was used for. So I would encourage that conversation. I welcome it. If there's a way to talk also about how this animal over time has become barnacled and has actually impeded people and made it more difficult to live a life of desistance.
Okay, Stacy, I'll have you introduce Professor Janis.
Sure. Thanks, everybody. So we have Professor Janis from Mitchell Hamlin School of Law. And I'm going to let you, Professor Janis, introduce yourself. And it'd be great to hear about the specialized work that you're doing now and the center that you have at the school and what that work is focused on as an introduction.
Sure. Thanks so much. And in a minute, I'll share a screen, and I do have some PowerPoints. But I've been working in this area of sexual violence prevention for about 30 years, focused a lot on the MSOP and the policy around that, but and in the process learned and written a lot about recidivism and how we use this, how we frame the issues, and how we might think about putting our prevention resources in the best places. Again, I'm former president and dean at Mitchell Hamlin, currently emeritus, and director of a program that is designed to provide resources for lawyers and other policymakers around the country who are addressing these issues of management. So with that, is it okay if I share my screen?
Yes.
Yeah, and I just want to talk about, Professor Janis is going to, I believe, share a little bit about the rates of recidivism, and that there might be a little bit of duplication to what Brian just shared, but I think there'll be a larger relevance as we can see going forward.
Yeah, and I apologize if there is some duplication. I just was able to join at the end of Brian's presentation. I know that I was planning to talk a little bit about the same study that he was talking about. But I was asked to give a little bit of a primer on recidivism. And what I think this is really important because these programs that we have, the registry and MSOP, are both really focused on recidivism. So what do we mean by recidivism? We're talking about a sexual reoffense after conviction. So recidivism, as I'm going to explain, is a very, very small part of the problem of sexual violence, but it is the part that these programs focus on. Usually it's measured by rearrest or reconviction. Recidivism rates are dependent on a period of follow-up. The longer the follow-up period, the higher the rates measured are in general. As has been mentioned, we have to have a caveat here that we're talking about measured or detected recidivism. That may be an underestimate because a lot of sexual violence is unreported. And even among sexual crimes that are reported, not all of those result in an arrest or a conviction. So there's a certain amount of drop off. How that phenomenon relates to the actual measure of recidivism is quite complex, and it's not a direct relationship. But we should just be aware that there's two different concepts here. There's actual, there's the sexual violence crimes, and then there's the detected crimes. Another concept that might be relevant is to distinguish between absolute and relative measures of recidivism. Sometimes some of our policies are dependent on the notion that people who've been convicted of a sex offense have higher rates of recidivism or lower rates than other people. Those are relative measures, and those relative measures are not as directly affected by this unreported the phenomenon of the lack of reporting. Now, the rationale for both, for most of these programs, in particular, the registry, was the notion that I'm going to suggest is a myth, that sex offenders are almost certain to reoffend. And I've put up some language from the key Supreme Court case, Smith against Doe, that suggests that the court there assumed that almost all sex offenders reoffend, as high as 80%. But what we know from research now is that recidivism, in particular, I'm talking about measured detected recidivism, is nowhere near that. And there are clearly a number of reasons for that, but what we know, what the science shows us, is that, for example, the 3-year recidivism rate was about 5%. For child molesters, about 3%. More recent study, and these are studies by the Department of Justice, Bureau of Justice Statistics, shows that 8% of people released from prison after a sex offense conviction, 8% were rearrested for a new sex crime. 92% were not, and that was within a 9-year follow-up period. Furthermore, we know that sex offenders are less likely than other released prisoners to be arrested during the 9-year period following release. Just some examples, prisoners who were in prison for a violent crime were rearrested at a rate of over 40% within that 9-year period for another violent crime. So in a number of ways, sex offender recidivism is lower than recidivism for other crimes. One interesting, I think, fact or statistic that comes out of these reports is that prisoners whose commitment offense was robbery or assault were rearrested for rape or sexual assault at rates of 3.4% and 2.8% respectively. So it turns out that actually a fair amount of recidivistic sexual offending is done by people who are not in prison for a sex offense and hence would not be on the registry. Risk among released sex offenders is heterogeneous. We can't put all folks in the same bucket. We know that risk is below average for most sex offenders. Here's risk levels in Minnesota. Level 1, 56% of the people released from prison are classified at the lowest level of risk. Similar statistics in other states, such as California. We know that risk declines with age. This is true for most criminal behavior. It's also true for people who've committed sex offenses in the past. Again, risk varies by age at release. And then I know that this is what Brian spoke about, so I won't focus on it very much, but risk declines with time, offense-free in the community. Important studies by Carl Hansen and others demonstrating that the risk of reoffense approximately is cut in half for every 5 years of offense-free living in the community. And Hansen and others, including myself, feel that this is a very important statistic in terms of figuring out where the most effective place to put our scarce prevention resources is. Recidivist sex offending is a small, very small part of sexual offending. Now, this is important because, again, the registry focuses only on people who've been in the criminal justice system for sex offending. That's where the spotlight is shown on. And it turns out that these folks constitute a very small part of the problem of sexual violence in our society. So most sex offense arrests are first-time sex offenders. About 95% of the people arrested for a sex offense, this is in a New York study, had no prior conviction and hence would not be in the registry. This is a Minnesota statistic. Most sex offense convictions are first-time sex offenders with no prior sex offense conviction. About 93% of those convicted of a sex offense had no prior sex offense and therefore would not be on the registry. That basically is my presentation. I'll end my screen sharing here and happy to take any questions that folks have.
Stacy.
Professor Janis, can you tell us a little bit about that Smith v. Doe case where, what was the climate going on in that case where the court said that there was an 80%, it was frightening and high, and it was around 80% recidivism. That case continues to be, good precedent. And I think is, what the public would generally think of people who are on, the registry is that if they're on the registry, they're probably going to be going out and offending again. Can you tell us, at that time, what was going on? And, is it just the research that has changed our understanding?
Yeah, since that time, and that was one of the key Supreme Court cases upholding the original registry, which again was conceived of as a law enforcement tool in general. We've learned a lot about recidivism since that time. There's been just a lot of research that's been done. The original, citation in that Supreme Court case was to basically a pop psychology an article in Psychology Today. It wasn't research based; it was anecdotal, but it does reflect the notion of the quote unquote sexual predator. The idea of the sexual predator is someone who lacks any kind of self-control and has some kind of internal mechanism that means reoffense is almost inevitable. And that's the image that the courts had, and certainly the image that a lot of people in the public have. And the research has shown that actually it's not the case. Now, what's changed? Well, A, we've done the research, and B, our approach to sexual violence has changed over the years. We have longer sentences, better treatment, more supervision, and all of those things have contributed, no doubt, to a decline, an actual measured decline in the rates of recidivism over the years.
I'm raising my hand.
Angie.
I just wanted to clarify, for those who don't know, that Alaska versus Doe was the United States Supreme Court case that was looking at the Alaska registration statute, which actually included broad internet-based, dissemination of information, which ours does not do. But just so they know, that was not our statute that was being evaluated. That was Alaska statute.
Sheriff Heck.
I'm curious if there are any studies or any efforts that have been made to try to capture recidivism rates beyond just what is reported with criminal convictions. I understand that the research is based on criminal convictions and that you have to have some kind of, empirical thing to base that research on. My concern is that this crime is so chronically underreported. We have so much difficulty actually building enough information to make a case in law enforcement and then to get it prosecuted and convicted, that we're dealing with such a small slice of the actual problem out there that the numbers could be drastically different than what the actual picture is when you simply focus on convictions. So has there been any research to kind of take a broader look based on, victim reports or some other thing that is not simply convictions?
Yeah, there have been certainly some studies along those lines. Part of the problem is, of course, that as you mentioned, if what we don't know what we don't know. I mean, we know what we don't know. We know that there is a lot of unreported sexual violence and that there's a fairly high attrition rate as those reports even make their way through the criminal justice system, and that convictions are at the small end of the funnel. So a number of these studies are on rearrest, which is a more liberal measure on that. And recently there have been 3 or 4 articles that have tried to estimate what the actual recidivism rates might be, given the fact that there's a fair amount of unreported sexual violence. Those are quite problematic, but I'd be happy to share those with folks if they're interested.
Stacy.
Sure. So, Professor Janis, one of the things that we've heard is that in making any changes to the registry, there needs to be a showing that any change would increase public safety. And I think what I'm hearing from Sheriff Heck to just say is, as law enforcement generally, is that to the extent that we have a registry that might even have that 1 or 2% recidivism, it might capture that people that in and of itself is the very thing that we can argue increases public safety, that the registry increases public safety. If that's what we need to do to change the registry to show it increases public safety, then I guess it's a flip question of, do we know of any research or studies, data, anything that shows that, number one, the registry doesn't reduce recidivism, so it doesn't have a positive effect on recidivism, or do we have any data or research or thought leadership on whether registries actually may negatively impact public safety?
Yeah, we do. And there's, as with any social science research, there's a range of kind of results. But I would say the consensus, from my perspective, the consensus is that registries do not have a positive or a beneficial effect, in the sense that they do not decrease recidivism, and that they certainly don't decrease, in a broader sense, the incidence of sexual violence. Furthermore, there is some research that suggests that registries, and in particular notification, can have a perverse effect of increasing recidivism. And this is for the very reason that some people have mentioned, and that is that Janine was mentioning and Patty, the question of reintegration. And we know that reintegration of folks coming out of incarceration is very important in terms of encouraging desistance or law-abiding behavior. Community support, family support, jobs, meaningful life, all those things are very important. And there's a key study that came out of the University of Michigan that, again, suggests that the broader the registry notification regime is, the more likely it may be to impair that kind of reintegration with the detrimental effect on recidivism rates. So there is a statistical correlation between broad registration notification regimes and increased recidivism. The registry and notification regimes are not cost-free. They have a cost, certainly a direct dollar cost, which means we're not using resources on other prevention. And then they also may have an unintended consequence cost of impairing reintegration and therefore increasing recidivism.
Brian.
My comment was actually in response to Sheriff Heck's question about recidivism in terms of, is it conviction only, charge only? And just going to mention briefly that the static 99R1 scoring, that if somebody is, let's say they committed a criminal sexual conduct 3rd degree and they were convicted for that, and you're supervising them, they go out and are rearrested for a new sex offense. Even if nothing ever comes of it, no charges, anything, you can rescore that static based on that rearrest for a new sex offense. Prior charges that are dismissed or even acquitted can be counted on item number 5 for prior sex offenses. So that tool does take into consideration other things that may have been going on that weren't, didn't rise to the beyond a reasonable doubt level in terms of scoring that instrument. Just wanted to make that point.
Patty.
I share Sheriff Heck's concern that law enforcement have every tool that they need to solve sexual crimes. But I do know that there is a negative effect to having such a hysteria about sexual offending and being on a registry, that it does provide a false sense of security. I know parents constantly check the registry for the bad guys and they feel the sense of safety. What I also know is it discourages reporting, because it's so often a family member or a close friend or whatever. People aren't going to call the police on a thing because they don't want their uncle or brother or dad ending up on a registry. So there is a huge negative effect that we're not really addressing. We don't know the numbers, but I can tell you anecdotally, I get calls and letters all the time, and I'm sure other people have heard of these stories too. So it's not, it's a false sense of security that all the bad guys are on this registry and that they're going to reoffend, and they're not all predators and they're not all going to reoffend. So we're not giving accurate information to the general public with what we're doing currently. So I'm in favor of looking at, I am in favor of giving law enforcement the tools, but the public side of it, it has huge negative ramifications.
Nate.
Thanks, Mark. So I guess my question is similar, well, kind of falls up on Patty's, but I'm just wondering about if there's any research on how effective the registry has been as a crime fighting tool. And in particular, I'm thinking about the fact that you're saying that, these people after a certain period of time really aren't any more dangerous than the general public. I'm wondering if is there also perhaps an effect where people are looking at folks on the list to the exclusion of expending the limited crime fighting resources on, just sort of trying to figure out the case and figure out what leads there are. And I'm thinking a particular case that I had once where it did seem like law enforcement was looking at the person who seemed like the most likely type of person to have done this as opposed to the actual person who had done it. I don't know if that's a very
I'm sorry, Nate. I think I can answer your questions with regards to the Minnesota registry. The Minnesota registry has not been analyzed or studied for purposes of recidivism, as that was not the purpose for which it was created. The registry was intended purely to be able to find individuals where they are. So no, a study has not been done on that because it does not include criminal history. It does not combine those two items, if you know what I mean. So we don't track individuals' criminal history in the registry. Now, in terms of the purposes for which people are pulling registrant information, first of all, I want to clarify the general public cannot access the predatory offender registry. The general public does not have access to this, has never had access to this. And so the general public cannot search predatory offenders. They can find non-compliant offenders on our public website, as is guided by statute under 243.166. But they cannot search for predatory offenders generally. That information is not public, that is private data. An individual will have to sign a release in order for that data to be shared with anyone, unless it is pulled for the purposes under which the statute allows, such as DHS background studies, such as corrections or law enforcement purposes. In terms of, and so I guess to follow up on your question as to what law enforcement purposes, information is pulled, no, we don't track that. We have not tracked that, as the statute simply says law enforcement purposes and then 2 other purposes. So we know that people are pulling for those 3 purposes, but we don't do follow-up on the results of that due to capacity, time, effort, etc. We simply don't have the capability to follow up on each and every data pull as to the results of that data pull, nor is it a charge for us under the statute. So just a couple of notes there. I hope I answered your questions, Nate. Nate? Okay, I'm gonna take that as a yes.
Nate, just.
Thanks. I'm sorry, I wasn't able to unmute myself. Yeah, I guess my question really is whether research has established whether or not the registry has been an effective crime-solving tool.
As I've stated, there is no research.
Senator Ingebretson.
Thank you. And I apologize for being on the road here, but I am hands-free to know that. You can hear me okay?
Yes.
Thank you. And thank you, Doctor, for the presentation. I have a comment and then a question. You commented that there was research as such that if the suspect isn't taken off the registry, that they're somewhat apt to reoffend because of that. I have a concern, certainly a concern about that. And then I have a question about one of your comments, and maybe you can help me with this. And it may seem like a foolish one, but I'm stumbling here. If you're saying the dollars being spent now on monitoring sex offenders like we do in Minnesota, that maybe our dollars could be spent better on preventative measures. Can you give me some idea on some preventative measures that would actually, in your view, work? Thanks.
Sure. Yeah, I guess the questions are directed to me. Just to be clear, what I'm referring to is some research that shows that registry and notification regimes are statistically associated with an increase in recidivism. So I don't know that you can say particularly about individuals, but that's the statistical findings. And there's also a fair amount of concern that aggressive registry regimes do inhibit reporting. So on the question of prevention, yeah, there's a blueprint that has come out of it's probably 12 years ago now, came out of the Minnesota Department of Health on a public health approach to reducing sexual violence. There's a fair amount of research on that about primary prevention that is quite effective. There's a study, for example, out of Canada involving university-age people that showed a statistically pretty significant drop in the incidence of sexual assault as a result of these kind of interventions. There are other kinds of things that are not exactly directly primary prevention, but are tried and true. Supervision, and again, I want to make clear, I'm not talking about post-confinement supervision, intensive supervision and so forth. Those things are no doubt can be quite beneficial. Furthermore, law enforcement and victim support are both areas where there may be a shortage of resources in terms of investigating rape kits, investigating and solving crimes, supporting victims. All of those are areas where there's a need for resources. And we should be very cognizant of the question of what, where do our limited public resources go most effectively in terms of reducing sexual violence?
Sure. Okay, thank you.
Representative O'Neill.
Thanks. So the first thing, I'm so glad Olivia from the BCA spoke up, because we keep hearing this rhetoric that somehow the general public can research and look at the BCA's predatory offender registry, search for people. I know that there are other people out there that have produced some sort of maps, and you're supposed to be able to see who's around you. This data is private data. And so I think what we're confusing is someone's public criminal history record versus the POR. So I think we need to really be careful when we're speaking in this forum and be very clear what we're speaking about, because the POR is private data unless you are non-compliant. And thank you, Olivia, for pointing that out. You pointed it out multiple times, and it's getting a little old, honestly, because we should know by now that the POR is private data unless you're non-compliant. People cannot just randomly search the POR. So that being said, now the other thing I wanted to point out is that the Star Tribune did a pretty in-depth look at those that had reported rape. I believe they did in 52 different agencies. Now, obviously, there's way more than that across the state of Minnesota. But in the cases that they looked at, and they followed it and tracked it all the way from reporting rape all the way to conviction. And yes, there is a tremendous drop off. Less than 50% actually even get to a prosecutor. Of that, 7% overall had conviction rates. And if there was alcohol involved, it was about 3% conviction rate. So when we're talking about quote unquote recidivism, we need to put that in context very, very clearly. And I appreciate the professor put that into context, but something else we need to be very mindful of when we look at recidivism rates is our conviction rate. In the state of Minnesota, when they looked at the 3-year period, was less than 7%. So hopefully the changes that we made in statute will make it a bit easier. We did, Representative Moeller and I have done many things throughout the years, but the testing all the rape kits have shown that there are serial rapists that have been out lurking in society for decades, and now Hennepin County is finally prosecuting some of those. They had 1,700 untested rape kits, and as they've worked their way through them, they're finding serial rapists that they've been doing this for decades. So I just wanted to point those things out, and I really hope that we speak from a place of being educated and speaking. I don't know why parents are quote unquote searching the registry when they can't search the registry. So I don't know what that is about, but that is not accurate. I don't know what they're searching, but it is not the POR. Thank you for letting me clarify some things, and thank you, Olivia, again for sharing that.
Representative Moeller.
My comment is a follow-up to Nate's question, and I think that's an excellent question, because if the registration is used by law enforcement, the intended purpose is to use it as a tool to track offenders. It sounds like we don't have any research on that. And I just want to remind the group that if that's something you want to put in the report and ask the legislature to somehow determine that, whether that's law enforcement agencies reporting when they've used it successfully, of course, there's going to be added resources needed to be able to do that, and who are they going to send that information to? But that's certainly something that this group could ask the legislature to consider as some kind of report back on whether or not the registration is being used as an effective tool for law enforcement as it was intended. Also, when we're thinking about whether or not that's the right tool to use for tracking offenders, I just want to note that DNA evidence has really improved over the years since the registry was enacted. And that might be something that we want to consider at some point. I'd like to know more about when DNA is taken, how that's being used to track offenders. Is that more successful in tracking offenders than the registry? As Representative O'Neill said, we've now passed a law that tests all rape kits. So we have a lot more data on that end too. So I think that would be something that could be interesting for this group to explore.
Okay, so we're getting close to the end here. We're going to reserve 5 minutes for public input, but we have a couple of minutes here if there is. Yes, Renee.
Yes, Professor Janis, we know that when psychosexuals are completed and risk assessments are completed, there are those individuals that rise to that predatory-like behavior. So we know that, and if it's not at that point, we know that in their process of treatment, as they start to reveal more information, they're identified of this really is an individual that should register for 10 years. I also know those individuals because I supervised them that it was interfamilial. It was a one-time choice or mistake or decision that they made. We know that they are very, very much less likely to reoffend. Do you have any statistics on that? Because I am a believer that the registry is important, but I also do think that there are some individuals that perhaps they don't register at all. They haven't posed that question yet. Or if they do register, that off-ramp because of the interference that it creates for them when they are married, now have children, they have a job, and they have housing. So any information in respect to that?
I think that the key, it's a really important point, and that is, again, this notion that people with sex offense convictions are a heterogeneous group. And there's a range of risks presented, and those risks can change over time. And that most of the folks who are released from a conviction, after a conviction, are in the lower range of risk. So I'm not sure if that is addressing the point you're making, but I think it is that, and we can differentiate to a certain extent among the people based on the level of risk they present when they're initially released. And I think that the received wisdom is that the interventions ought to be based on that kind of risk assessment, so that we reserve our most intense resources for people with the highest risk, and we don't expend those resources on people with lower risk.
Right. And I would venture to say that law enforcement probably is not looking at those individuals on the registry, that they're not the pool of individuals that they'd be looking for, as far as matching up same behaviors with the new incident that had happened.
Yeah.
So I do want to mention that law enforcement actually can see some details as to folks' criminal history, and they can use the predatory offender system for that purpose. So they can actually look at patterns, those kinds of things. It's by far not complete. It's a narrative. It's very limited, but they can and at times do look at those patterns.
Okay, so we're in the public comment area. I have Sherry as one of the members. Will come back to you at the end for your question, but we have one public member at this time would like to make a comment. Bruce Bernhardt, if you could unmute.
Yep. Thanks for giving me a chance to speak here. I really appreciate this. Wanted to make a brief comment. Some of us are on lifetime registration here in Minnesota, not because our offense, had it occurred in Minnesota, would have required lifetime registration, but because we came from other states where everybody was a lifetimer, regardless of the degree of severity of the offense, in my case from California. And because Minnesota goes by state of conviction, that automatically put me and whoever else might be included on lifetime status when we moved here. But the laws in California and in a few other states are changing. And there is now a tiered registry in California, which would allow me to off-ramp. I would petition, and most certainly I'm sure I would be approved. But the point is, if I now move to Minnesota tomorrow or next week or sometime here in the near future, I would not be on the registry here at all, because my particular offense would have carried with it only 10 years of registration had it occurred here in Minnesota. There probably aren't many people who are in this category, and Minnesota can't possibly keep up with all the laws that are changing in 49 other states. But if there was let's say a petitioning process of some kind, or sort of special circumstances, I guess you might call it, that would give someone like myself the opportunity to at least kind of explain my circumstances and perhaps achieve the same relief as others who have lived here all along. So I just kind of wanted to put that point out there.
Okay, Sherry. Do you see the unmute button?
I do.
There you are.
Good morning, everyone. I just wanted to reiterate, this was a great call today. I think the data was really sound, Brian. I appreciate everything that you sent through. And I think for a lot of us, the data associated with the static or stable assessment processes seems to be incredibly real and valid. And so when I ask the questions about the frequency by which it's utilized, I also sit in the same camp as Sheriff Peck and suggest that the registry is valuable. And it's valuable for maybe law enforcement's purposes. But as we on this task force try to converge, every subgroup crosses, right? There's so many challenges. So I had one question that I have raised with Olivia before. And again, I may be the minority in this because you guys are, working your schedules. Is it beneficial for us to try and meet in public or spend a dedicated day where we're together? Because these small group sessions that we're doing and the things that we need to accomplish, Mark, are we better off to put some full day meetings on the calendar and try to work through some of these things together? That's number one. And number two, I, as an employer, I think about the compliance associated with the registry, and then some of the collateral consequence discussions. I think that one of the things that we think about in terms of rehabilitation, there's two. Like Brian said, getting the right treatment, off-ramping based on the treatment that you've had and the assessments that actually could serve to re-level you seems critical. And so are we assessing frequently enough to make those determinations? And then two, from an employer perspective, there are states that I have worked in and had under, kind of my supervision where fair chance relative to felonies is an important part of making an employment decision. And you find employers particularly pressed by the EEOC or by OFCCP upon making subjective hiring decisions, and nowhere is there an opportunity for us to discuss this because the collateral consequence of employment. Yes, to Representative O'Neill's point, public criminal records, when we run backgrounds, we see it. So there's a lot of things that I think we're all trying to converse on in various groups, and it feels as if we need to spend more time together. And I don't know if I'm out of line in asking for that, but there seems to be, these separate conversations that really could be short-circuited if we were all together. And then the last thing I'd say is that I know there was a previous comment made on some of the preventative measures, and Dr. Janis, it was wonderful to hear you speak. I did at the privilege of doing a 130 child training in my town last weekend on No Not Me training for K through age 15. And while I agree with Patty that a lot is not reported, the proaction that I saw in these children's faces made me suggest that one of the outputs is that the educational system create awareness around personal empowerment, kind of understanding on and off limits from your own body's perspective at a very young age. And our sheriff's department facilitated with me, and it was an amazing thing. But we haven't really talked about some of the things that could get out in front of this. I know it's a registry group, but the questions I think are so many, there's so many converging issues, Mark, that I thought perhaps maybe there was another forum as we get closer that we could just dive more deeply into these than a 2-hour call. And I don't know if I'm out of line in asking that.
No, I don't think you're out of line at all in asking that question. And I just received your email to Sheriff Heck with the question. What I will say is that at least when it comes to state buildings, we are currently shut down. We can only accept individuals under a limited basis, and even our own employees are being tested, having to show proof of vaccination, et cetera. So in terms of having a group of 40 people here, that's going to take a bit of
thanks, Mark.
Finesse.
Understand.
And so that is something that, we discussed at the outset of this group was how much could we have in person versus how much could we have remotely. And because of the way that things have evolved and changed with COVID and other restrictions, that's why we have kind of done the Zoom thing. I think the chairs and Mark and I are happy to discuss any potential for other opportunities. And if there are safe ways, perhaps in larger capacity settings where that can happen, even if it's not a state building. But I think that the issue is going to remain the same, that there are going to be people who are not comfortable attending in person, that there are people who are not able to attend in person for their own health issues, and that we're going to end up with some version of Zoom, et cetera, for safety and well-being.
Absolutely understand that.
We'll continue this discussion, but absolutely a valid request there. So unless there is anything else from our chairs or from Olivia, we're past our time here, and we want to respect that time.
So the only update that I have is that we will have a new member who will be splitting time with Chief Tuscan out of Duluth PD. It's Chief Padani out of Blaine. They are both overwhelmed with work, as I'm sure everybody else is, and so they are going to be splitting time and splitting working group membership and figuring out how best to have involvement with that. So I just wanted to let folks know that that's fresh off the presses there. In terms of anything else, I guess not, but we'll continue to have discussions about meetings, and we'll see you all on Monday then.
Thank you.
Thank you, everybody.
Thanks.